Dr. Donna Willis, and we're talking about liposuction. And liposuction is not just a simple procedure. It's simple for a trained and skilled surgeon to do, but this is a surgery. And too often they think about it as just sucking out fat cells. But let's describe a little bit about what happens after the surgery.
Yeah. Well, you know, most of the procedures that we do, the liposuction procedures, are done under a local anesthesia with sedation, so that postoperatively the patients are pretty much awake right after surgery. Hour and a half or so after a moderately small volume liposuction, assuming that everything is fine, they go home. Patients who have larger volume liposuctions are observed for a longer period of time because of the injury, so to speak. When I use the word injury, I don't mean it in a bad way. I mean the physiologic changes that result from the liposuction have to be observed for a period of time until they stabilize. So those patients are observed in the surgery center or in the hospital for a longer period of time. But typically a patient will go home with some sort of compressive garment, like a girdle or a stocking, to help minimize the swelling and the bruising in the treated area. And that'll remain in place for a number of weeks. And patients are encouraged to begin to walk and to slowly begin to get back into their normal activities. And to the extent that they feel comfortable doing aerobic exercises, jogging, and so on and so forth, they can do that whenever they're comfortable.
But a little incision is made for the little cannula, or like the size of a big pen, to go through to suck out. You put the fluids in, and then you pull the fat out.
Right.
However, there's some bruising and some discoloration that may be associated with liposuction, isn't there?
Sure. Certainly the more fat we're removing, the more potential for bruising and swelling. A lot of that is minimized by the fluid that we put in prior to suctioning. Again, to some degree, the amount of bruising and swelling is dependent upon the propensity of that person to bruise and swell.
Okay.
There are people who bruise more easily than others, and that bruising can last for up to 3 weeks or so. By and large, we would generally say about 80% of the swelling resolves in the first 3 to 4 weeks. But it takes a good 3 months before you're completely healed and you can see the finished result.
And that's very important for you to know, so that you have the proper realistic expectation for this surgery. It's not you're going to have it in 2 days, you're to that size and that contour that you want. It takes a couple of weeks before you begin to see the kind of results, and maybe, as Dr. Zubowski talked about, 3 months. Joanne, you're on the air.
I have a question.
Yes.
Back in 1996, I had a hysterectomy, and I was cut down below the navel. Mm-hmm. And I had lost weight, and I had a flat, the flap of skin. And periodically, I suffer with agitation to where the incision was done.
Okay.
And my question is, I still need to lose like 30, 40 pounds. I've lost a lot of weight on my own. Mm-hmm. I'm 5'6", and I weigh 210 pounds. I do walk a lot, and that has helped me a lot as far as, losing weight. My question is, should I wait to lose the 30, 40 pounds, or should I go and seek to get this done?
Okay, it seems to go back to some of the real questions about when is the best time as far as your weight and what your body looks like to get the most optimal results.
Right.
And, you were talking to one of our other callers about what needs to happen to get to that point. She seems to be the same patient. Describe again what she should be thinking about realistically.
Well, I think that realistically you need to get as close to your ideal body weight as possible. You really need to do that religiously, because we can't get the kind of results we would like to get unless you are close to your ideal body weight. You mentioned pain in the scar. That is a different issue, I think, than contouring with liposuction. That issue of a painful scar, depending upon what the problem is, can be treated in other ways. If contour is a problem, then again I would say that as close to your ideal body weight as you could get would give you the best result possible, assuming that the quality of that skin is good.
And when we're looking at ideal weight, we're not looking at the pencil-thin weight. If somebody is, let's say, at a size 14 and they get down to a size 10 and they still need more weight to lose, that may be where they want to be. And again, finding the right doctor and understanding what's realistic is very important, and we're going to cover this and more when we come back. So please, if you want to know if your insurance covers it, those answers to those questions and more when we come back. Stay tuned.